Welcome everybody, with you Dr. Magdy Abdel, consultant of infectious disease, hepatology and gastroenterology. Our topic today about topic of HIV and its relation with oral sex. So, can I get HIV from oral sex? Oral sex carries little to no risk for getting or transmitting HIV. Theoretically, transmission of HIV is possible if an HIV positive man ejaculates in his partner mouth during oral sex. However, the risk is still very low and much lower than with anal or vaginal sex. There is the biological possibility that the oral mode of sexual contact with ejaculation can transmit HIV in less than 5% of cases. HIV lives in blood, semen, body fluids, and breast milk. So it can infect a person when it gets in through the blood, either through mucous membrane or through the breaks in the skin. So through oral sex with ejaculation, what are the other risks that will increase the risks of transmission? Soreness, that is an ulcer, inflammation also, any allergies, concomitant sexual transmitted disease, and immunosuppression. All these things further increase the risk of transmission of HIV through the oral route. Can HIV be transmitted through oral sex, fellatio, and cunnilingus? Yes, but the risk is relatively low. If you are worried about HIV infection, you may wonder whether it is safe to have oral sex. While it is not risk-free, the chances of spreading the virus that causes AIDS are very low if you take the right precautions. The chance that you will get HIV from receiving oral sex, that means a partner mouth is on your genitals, is very low compared to unprotected vaginal or anal sex. But it is not easy to know what the actual risk is. This is because most people who have oral sex also have vaginal or anal sex. It is tricky to figure out each factor on its own. It is thought to be riskier to give oral sex rather than receive it. This is because you may have small cuts or sores in your mouth, even if you are not aware of them. There is also risk from partner fluids, which may get into contact with your mouth and throat. Mouth to penis oral sex is thought to be riskier than mouth to vagina oral sex, but the risk is still much lower than with other types of intercourse. The chance of being infected with HIV from analogous, this means oral anal sex, is also considered to be very low. The bigger risk is that you become sick from certain other viruses or bacteria that live in your partner anus. HIV is transmitted through seminal and vaginal fluids, including menstrual fluids. The virus can enter the body through the bloodstream or by passing through delicate mucous membranes, such as inside the vagina, rectum, or urethra. If a person is having oral sex and has bleeding gums, a cut, or an ulcer inside their mouth, HIV could enter their bloodstream through infected fluid. In the same way, a person with HIV could give HIV to their partner during oral sex through that person's vagina, rectum, or urethra. Using a condom during sex, including oral and anal sex, is the best way to prevent sexual transmitted infections, including HIV. Avoid use an oil-based lubricant such as Vaseline or baby oil because they can weaken the condom and increase the risk of it splitting. You can use dental dam to cover the anus or female genitals during oral sex. A dental dam is a latex or polyurethane, a very thin, soft plastic, square measuring about 15 centimeter by 15 centimeter. It acts as a barrier to help stop sex transmitted infections passing from one person to another. So, transmission of HIV, uh, it is transmitted through the exchange of bodily fluids, such as seminal fluids, vaginal fluids, including menstrual fluids, also through breast milk, blood. The mucus found in the rectum pre-cum, the fluids that the penis produces for lubrication before ejaculation. You cannot catch HIV from kissing. Evidence shows that HIV virus is spread through the exchange bodily fluids such as blood, semen, and vaginal fluids, but not saliva, being sneezed or by someone with HIV. Sharing baths, towels, or cutlery with HIV infected person, swimming in a pool, or sitting on toilet seat that someone with HIV has used, all these methods cannot transmit HIV. Also, animals or insects such as mosquitoes cannot transmit HIV. Uh, Other body fluids such as saliva, sweat, or urine do not contain enough of the virus to infect another person. So, what is the risk from oral sex? As results uh, showed that undetectable viral load, they cannot pass on HIV. According to public health research work, so about from 1 to 3 percentage of sexual HIV transmission are because of oral sex. Unprotected anal and vaginal sex leads to far more HIV infections than oral sex. The risks are higher if a person giving oral sex has cuts, sores, or abrasions in their mouth or gums. So, I will leave my WhatsApp. If you have any question or you want to send medical reports, 00201027284778. Thank you very much.